A lot of people ask about why there's not a vaccine, or why there's such difficulty getting people vaccinated.
So the vaccine part, that's an excellent question. Why do we not have an effective vaccine against malaria? Well, most of the diseases that we have good vaccines for are the kind of disease, if you get them once and you survive them, you have lifelong immunity to them. So a rule of thumb for vaccine production is that you're never going to get better protection from a vaccine than you do from the disease itself. Well, in endemic areas, the people that live in endemic areas, they get malaria about every 6 months. And so they have immunity that lasts about 6 months. So the possibility of a vaccine working much better than that are slim to none until we can develop the type of vaccine that actually targets DNA or nucleic acids. There are some cutting edge technologies out there that are helpful or hopeful, but they're not coming down the pike anytime really soon. Those are in the future. There are some very good vaccines that have been developed that do mimic this cycle, that do prevent the malaria for about 6 months. The good news is that might prevent the death of babies. If you can get beyond infancy, you have a better chance of surviving this organism or this infection. So people that live in endemic areas, they have a little bit of residual immunity. So each time they get it, they're not quite as sick as they were the time before. So if that initial infection could get taken up by the vaccine instead of an active infection, that would be a good thing, because then when they do get it, they're not going to get as sick. We as travelers from the developing world, if we go to Africa, if we got malaria, we would become as deathly ill as an infant child in Africa, because our immune systems are totally naive and we have no protection. Whereas another adult who's lived in the area has a little bit of immunity going. So they're not targeting adults with vaccines, mostly babies and some pregnant women, because pregnant women, their immunity tends to drop and they're at a higher risk too. So it's promising, but it's not good yet. Yeah.
What is so powerful about the recent developments in medication and diagnosis?
Okay, so this is an exciting piece, and this is why Imagine No Malaria. So, and you're going to have to help me with some of the numbers here. Back when the Nothing But Nets started, how many years has that been now?
2006.
Since 2006, so 7 years-ish, 6 or 7 years. From the time that started until now, the death rate from malaria in children in Africa has been cut in half. It's gone from a child dying every 30 seconds to a child dying every minute, which is still pretty awful. But NETS cut the rate of death from malaria by half. So we want now to imagine no malaria. But what's exciting about right now is within that time, we've developed new drugs that actually come from the wormwood plant, artemisinin, and several of us have this in our gardens. Look at some of the labels of some of your ornamental plants. It's exciting to see it. Oh, it's in my garden. But so the wormwood plant, it's an extract, and it kills more efficiently, it's cheap to produce, and it's being widely distributed. So it is now the drug of choice. A lot of, especially in West Africa, there was a high level of resistance to the classic quinine derivatives that we use for malaria. So there were a lot that had to use much more toxic drugs. Now we've got one less toxic, more effective, cheaper. Doesn't get much better than that. Also, many of you have seen the little instant pregnancy tests that you can buy in the drugstore. Previously, we would have to either stick somebody's finger or draw blood from their arm, put it on a microscope slide, and do a pretty complex staining, microscope slide staining, and then examine it under a microscope. So you had to have electricity that worked, and you had to have a trained technician to read the slides. And that takes quite a lot of time. So the reality was everybody that had a fever, they got treated for malaria. And a lot of them went to an herbalist and got less than wonderful drugs. Now these kits are being made available by the World Health Organization, which is one of the funding organizations for Imagine No Malaria. They don't need to be refrigerated. They can go in remote areas. We can increase the efficiency of the drug use because we can have more accurate diagnosis. So that's why now that it's a little bit emergent. We need to do this right now because we've got drugs that work, we've got testing that works. My old lady brain is wandering. Did I answer the question?
Yes, but if you could continue with the herd immunity piece.
Okay, so the idea of herd immunity, that, and this is an expression that's been used in the vaccine world for a lot of years, that not everybody, for instance, for not everybody would a vaccine necessarily be safe. They're almost always effective, but there are populations of people for whom it wouldn't be safe. And so this phrase, herd immunity, came about because we would have individuals that couldn't be vaccinated, but the more people around them that are disease-free, that are protected, the less likely they are to get the disease. So if we can knock out more and more and more of the human reservoir, the fewer people that have the infection, the less likelihood it is for a mosquito to bite an infected person and be able to spread it on. So, and the emergent part of this is that mosquitoes are, in the science world you'd say hypermutable. They mutate rapidly in the presence of noxious chemicals or chemical stimuli. So they rapidly evolve resistance to pesticides. Same goes for the little parasite. It's a tiny little bug that lives inside of a red blood cell, but it has a very complex nature. It's not like a little bacteria that just one becomes two. It's a prokaryote. It's a eukaryote. It's a much more complex cell. But it has this ability to develop resistance. So right now, we have insecticides that work on the nets. The nets are almost as effective just hanging in a room as they are over a bed because of the effectiveness of the insecticides right now. Same goes for the drug. Right now, it works. But we know that resistance is on the horizon. There are mosquitoes now that are beginning to fly right past these nets. There are people in some areas of the world, fortunately not so much yet in West Africa, where the malaria parasite has developed some resistance to the new drugs. So the urgency of the Nothing But Nets is that we've got a window in time right now where the drugs work and the insecticides work. And if we can knock it out, pour a lot of money, get a lot of drugs, get a lot of nets, and educate the people on how to do this, we really do have an opportunity to stop this thing. So it's exciting.
Yeah.